Hey everyone, good day to all. Welcome to episode number 3 of all 19 subjects PYT series for the FMG guys. Okay, for the PDF guys, the link in the description, and also guys, I'm conducting series of quizzes subject wise and also the topic discussions in the Telegram. You can just join in the group. Just search FMG aspirant Dr. AJ Moria in the Telegram guys, and also you will get the PDF also in the group only. Okay. So let's start. So guys, the first question is the first topic is the STDs. It is the STDs. Okay, STDs will get one question. So guys, uh, see here, STDs we are having the two types. This is painful, painless, painful, painless. See, painful we are having the HSV, and this is a chancroid. This is a chancroid. This is chancre. This is chancroid. Okay, na? See, painful two types. See, this is the herpes simplex virus. Okay, na? As you know that viruses, they don't have the pulses. Only the fluid filled vesicles. Fluid filled vesicles. There is a polycyclic erythematous. Okay, na? Also known as and can see here in order to view them you have to use the Chang smear. You have to use the Chang smear. Okay, now you see the Jain cells here. The Chang smear done for the HSV. Treatment is the acyclovir 800 milligrams 5 times per day. Next one is the painful. It is the chancroid. It is the hard chancre. Okay, na? This is called by Ducre. See, H Ducre. Ah, why you will cry? Because of the pain. That's why it's painful. Okay, na? This is non-indurated. This is hard. Okay, na? This is having the dirty margins. Okay, na? Dirty margins. It look like school of fish appearance. How it look like? Say, school of fish appearance. Okay, na? See in the chancroid. Okay, na? Please close please correlate with the images also. Okay, now while you are studying, just search in the Google chancroid. Okay, now images. Treatment is the azithromycin. The next one is the painless. We have in three types. Chancre means what? It's a syphilis. See, painless syphilis. Painless syphilis. Syphilis, painless, 3P. P for painless, P for syphilis, syphilis, and P for penicillin. Syphilis, painless, penicillin. Okay, na? See, syphilis caused by Treponema pallidum. Treponema pallidum, it is soft, clean base. On dark field microscopy, we will see the corkscrew pattern. This is the corkscrew pattern of the bacteria. Okay, na? Now, so guys, the overall is the VDRL is the best one. VDRL test is the best for the detecting the what? Syphilis. Okay, na? For the treatment, it is the benzathine penicillin. Benzathine penicillin is the treatment of choice. For the neurosyphilis, you have to give the aqueous benzathine. Okay, aqueous benzathine. Then next one is the donoanosis. This is the donoanosis. Is caused by Klebsiella granulomatous. Caused by Klebsiella granulomatous. It shows there are there are more papule. You have to remember that it bleeds on easily. It bleeds easily, and there is a beefy red ulcer. There is a beefy red ulcer. Beefy red ulcer. Okay, na? Just remember these 2 points for the donoanosis. Okay, na? It also what type of appearance? Safety pin appearance. It is having pseudobubo. Okay, pseudobubos are present. Okay, na? Treatment is the azithromycin. LGV, lymphogranuloma venereum. Okay, na? It is caused by chlamydia trachomatis. Chlamydia trachomatis. We are having the inflamed lymph nodes. There is a bubo. True bubos are present in the LGV. Pseudo bubos are present in the donoanosis. Please remember this one. There is a green blood sign. There is a green blood sign. Okay, now. Okay, now we are having the types L1, L2, and L3 types of the LGV, and the most common site will be the ulva. Okay, na? Drug test is the doxycycline. So guys, from this one you will get the one MCQ. Okay, done. Next one is the okay, guys. This one. So guys, please see this one, guys. Okay, first let's remember the trichomonal vaginitis. Okay, trichomoniasis. Okay, na. So guys, just remember there is one story is that okay, na. This is the strawberry. This is strawberry. These are the leaves. Okay, na. As you know, the strawberries they are very costly. That's why only rich people will able to eat the strawberry. Okay, na. See, See here, this is the strawberry. This is the strawberry cervix. This is the strawberry cervix. Leaves are green. It means there is a greenish discharge. There is a greenish discharge. Okay, now strawberry cervix, greenish discharge. And the culture media is diamond media because diamond only rich people can buy. That's why strawberry rich, diamond media, culture media also diamond media. Okay, now what is the treatment? Treatment is the guys. Suppose example, see, I went to buy strawberry by via metro. I went to buy strawberry via metro. Okay, na? How does metro? How does metro moving? Okay, na? That's why I see here the trichomoniasis. It's a it's showing the teaching modality. Okay, na? I went to buy strawberry via metro, and how does metro moving? It's a see everything is done in one single story. Okay, na? See here. Please remember here. Okay. See, for the bacterial vaginosis, guys, we have to remember that it is caused by the Gardnerella vaginalis. Gardnerella vaginalis, and also it follows the Amsel's criteria. It follows the Amsel's criteria. It is grayish white discharge, fishy odor, fishy odor due to what? Fishy odor due to release of amines, ecridine, and pyridine. There is a whiff test positive. There is a clue cell. What are clue cells? What are clue cells? Clue cells are vaginal epithelial cells loaded with the organisms. Okay, na? They are the clue cells. Clue cells. Okay, na? Remember, other treatment choice is the metronidazole. But other drugs you can use clindamycin, and also you can use tinidazole. Okay, are you done? Ting, ting, ting. Next one is the candidiasis. Candidiasis, you have to remember the cheesy and curdy white discharge. Okay, na? And also remember pH of vagina it is less than 4.5. Less than 4.5. Remember candidiasis pH is always less than 4.5. Okay, okay, na? Drug test is the fluconazole or patronoxol. Fluconazole, it's going to be the 150 milligrams. Okay, 150 milligrams. Okay. So one MCQ from here, one MCQ from there, two MCQ we covered. Next is the diabetes. Next is the diabetes, guys. Okay, done. Diabetes, guys. One MCQ from the diabetes. Okay, now see here. As you know that the most common type of diabetes is the type 2 occurring in the more than age 30 to 40. Okay, now see here, guys. For the diabetes, we need to remember the test. See how they are going to give the questions. They are going to give a to interpret a RBS or FBS or HbA1c results. Okay, suppose they give there is a FBS, the normal the FBS the value obtained is the 110. Then what is the condition? It is the pre-diabetic. Okay, it is the pre-diabetic. Like this you have to interpret. So guys, see here for the overall best method, best test for the diabetes is it is the fasting blood sugar. It is the fasting blood sugar. The fasting blood sugar overall best. But for the long-term sugar control, it is the best one is the HbA1c. It is the HbA1c. Okay, na HbA1c is the best one. For the long-term sugar control, it is the HbA1c is the best one. Okay, now see here for the FBS guys, it is the normal value is the less than 100. Is the less than 100 for the if the patient is pre-diabetic, it means the value is the 100 to 125. Diabetic means it is more than 126. RBS. So guys, before doing RBS, you have to do the glucose tolerance test. You have to do the glucose tolerance test. How much how much how much glucose you have to give? You have to give 75 grams of glucose orally to the patient. Okay, now. So after 2 hours, you have to do the random blood sugar. Okay, now the normal value is the less than 140. Pre-diabetic, it means it is range from the 140 to 199. Diabetic means it is if it is more than 200. Okay, na? More than 200. See guys, for the HbA1c, the normal value is the normal value the 5.6, diabetic 6.5. See here the panja panja 5 chakka 6, 5.6 chakka panja means 6.5 diabetic. See, normal is 5.6. If you reverse this one, it is 6.5. So normal is 5.6, reverse is 6.5. It is diabetic 6.5. It's very easy to remember. See here, pre-diabetic means 5.7 to 6.4. So guys, while treating, you have to always maintain the target HbA1c is always 7. Okay, now please remember these guys will get the one MCQ from this one. Okay, now done. Next one is the types of headache. Types of headache. See here, get that from the types of headache. See here, guys, we having the tension types of headache. Three types of headache: tension, cluster, migraine. See, tension headache. This is the this is the most common type of headache. Okay, na? Overall, most common headache. Guys, this is tension headache is more common in the female. Okay, na? What are the characteristics of the tension headache? It's like a band like compression. Someone is squeezing type. Oh my god, someone is compressing my head. Okay, now like this one. It's a band like compression. It's a featureless. There is no nausea, no vomiting. Just a band like compression. Okay, now sensation over the head. Okay, now it is due to stress, intense emotion, and also fasting. Treatment will be the anxiety. Okay. Next one is the cluster headache. See here, guys. Cluster luster. Who will be the more lust type? See the males only now. So it is common in the more common in the male. This is the more common in the male. Okay, now see here, guys. There is a unilateral headache. Okay, this is a unilateral headache. There is a history of the cry. See, it shows the retroorbital severe and the excruciating piercing means someone is piercing. Okay, someone is piercing with the needle type. Needle. Okay, na needling type. Okay, na it is also a part of the trigeminal neuralgia. Also shows red eye, increased tears secretion, crying and or lacrimation known as the epiphora. Treatment will always see here is the sumatriptan. First line is sumatriptan and the high flow oxygen. Other drugs we can use valproate, gabapentin, carbamazepine, and also guys remember for the prophylaxis it is the CCB, it is the verapamil CCB. Okay, CCB example verapamil. Okay, na. Next one is the migraine, guys. Is the migraine. So guys, please remember the migraine here. It is more common in the female. It is more common in the female. Okay, now it is a unilateral. As you know that it is a unilateral only migraine. It triggers a stimuli on light or sound. Okay, na? Triggers migraine is more on light sensitive. This is most light sensitivity and the sound. Okay, now it is the see here what happens. You have to remember that it is CGRP, calcitonin gene related peptide. It is going to increase in your body. That's why guys there is a inflammatory changes and there is a vasodilation. Okay, na? That's why guys the patient who is having the migraine, please try to palpate here. Please try to palpate here, guys. Here there will be a pulse. You will feel the pulsable dancing here. Okay, na? That's why, guys. See, this color we are showing the. Hence, the migraine has the vascular pulsatile. Okay, now what are the some triggering factors? They are stress, hormone fluctuation, and the sleep disturbance. Okay, now see here. Okay, now see treatment will be the see for the mild to moderate. You have to give the NSAIDs. For the moderate to severe gas, you have to give the triptans. Triptans or what 5-HT1B and a 5-HT1D receptor agonist. This is also one question. Okay, now mostly we will use the sumatriptan. See, remember here, sumatriptan is contraindicated in the stroke and the ischemic rheumatic heart diseases. And you have to please remember this one. Okay, now. And also, guys, the early for the treatment of the migraine, guys, they are using the methyl ergotamine, ergometrin. Okay, now, also called as methargine. Okay, now, because it is contraindicated. It is contraindicated because the side effect is the side effect is what? Side effect is the what? Side effect is the gangrene. Okay, na? That's why it's a completely contraindicated. Okay, now see here for the prophylaxis, guys. For the prophylaxis, they are giving the propranolol. Prophylaxis propranolol in the sub example. So okay, now see here, guys. If the patient is obese, and she is having the if the patient is obese and he or she having the migraine, then you can give the topiramate. Topiramate. Okay, done. Types of headache. Next, coming to the types of seizures. Types of seizures, guys. Okay, na? Okay, guys. There is one of my video in the YouTube, guys. They just try to search in the in the YouTube, guys. That seizures by medicophily. You will get the types of GTCS and everything is. I made a role play in the YouTube, guys. Okay, now. Okay, see here, guys. First one is the most common type is the GTCS, guys. Okay, GT generalized tonic clonic seizure. Generalized tonic clonic seizure. It is most common in the young adults. Most common in the young adults. It is also called as grand mal epilepsy. Grand mal epilepsy. Called the grand mal epilepsy. Okay, now see here, guys. It's called grand mal means what? Old shell. What is petit mal? Petit mal means it is the school going children's young children's. Okay, na means petit mal, also called as absence seizure. Okay, now see here, generalized. See what happens here actually is that see GTCS, guys. See like this one. They see suppose I am here. I am teaching you. Okay, now suppose while I am teaching, I will suddenly fell down. Uh, 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 See what happens. You see here, see tongue biting, there is more salivation, and there is a contraction of the sheath. It's a clench. This is it's like this one. Teeth ulcer, jerky movements. Okay, now I will just fell down. Okay, this is the GCTS seizure. The first there is a loss of consciousness. This is the patient will fall down. Second is a tonic stage. All muscle goes into sustained contraction. Teeth is clenched, tongue bite. Okay, now okay, na? So guys, to prevent the blood, to prevent the aspiration, guys, you have to turn the patient always the right side. Okay, na? Always the left side. See here, guys. Third stage is the clonic stage. This is the all muscle contracts and the relax multiple times. There may be the nausea, vomiting, headache, confusion, amnesia. Okay, na? So guys, please remember the GTCS. So guys, if the GTCS continue more than 5 minutes, if the GTCS continue more than 5 minutes, then it is called as status epilepticus. It called as status epilepticus. It is called as status epilepticus if the GTCS is more than 5 minutes. Okay, na? So guys, please remember here what is the treatment for the status epilepticus? The treatment will be the IV lorazepam, IV lorazepam or IV phenytoin or IV midazolam. Okay, na? IV lorazepam is the first choice. And also remember here that IV phenobarbital, it is contraindicated in the porphyrias. Okay, na? So guys, here remember here, guys. What is the treatment? What is the first drug of choice for the GTCS? It is the valproate. The valproic acid is the first. It is the first choice. But you know what? Valproic acid is most teratogenic to the. It is most teratogenic, and also and also causes the NTD, neural tube defects. See here, there is a one condition, guys. As you know that valproic acid is most teratogenic. The female who wants to be pregnant, they must have to stop valproate, and she has to use the levetiracetam and the lamotrigine. Levetiracetam and the lamotrigine. Okay, na? If the patient is already pregnant, and she is using the valproic acid. Okay, na? Then guys, she has to see how to continue the valproic acid and add folic acid. How much? It's a 4 mg. It's a 4 mg, 4 milligram per day. Okay, na? 4 milligram per day. Okay, na? 4 milligram per day. Okay, na? Please let me know is this correct or not. Okay, this is 400 microgram or 4000. It's a 4000. Please let me know. Okay, this one. Okay, next one is the. Don't worry, I will update in the description. Okay, next one is the types of seizures. The types of seizures. Okay, na. So guys, in the seizures we'll get the one question. It is the first one is the guys as okay. We completed the GTCS. And see here see guys, see the infantile seizure. It's going to infantile seizure. Infantile seizure is also called as salam seizure or west syndrome. See here, all muscles will goes into contraction, spasm, and there is a jack and knife position. See, the child will always do like this one, like this. Like salam, like this one. Okay, na? So he will say the hips arrhythmia. Treatment will be the ACTH. Jan syndrome or myoclonic epilepsy. It is the occurs in the morning due to sleep deprivation. Occurs in the morning while wake up. That is sudden bilateral myoclonic jerks. Remember the morning time. It is the Chan syndrome. Treatment will be the valproate. Subtle emotional unit. Treatment with the IV phenobarbital. Febrile seizure occurs in 6 months to 6 years children. Episode of fever. Drug of choice, rectal diazepam or lorazepam. Prophylaxis within the clobazepam. Absence, I told you, is a petit mal seen in the school-going children. There is a black staring episode. See, guys, the patient with the absence seizures. See, children with absence, see, like this one, they will sit on the benches while they're going to school, like this only. They will lose the consciousness and they will blink their eyes multiple times like this only. Like okay, now it's happening like this only. So because of this only, they will have the poor school activities. Okay, now poor study activities. Okay, now okay, now see guys, for the less than 5 years children, you have to give the ethocyanide. Okay, now for the more than 5 years guys, you have to give the valproate. Okay, now okay, done. Next one is the next one is the next one guys, from the malaria guys, we will get the one from the malaria. We will get the one question from the malaria guys. Okay, now see, a pregnant woman at 12 weeks of gestation. See guys, remember here. Remember here, in the for the malaria guys, you will get the one question here. See here, in the first trimester, if the patient was diagnosed with the malaria, that is with the Plasmodium vivax species, then it is the you have to give the chloroquine. If the patient is diagnosed with the diagnosed with the Plasmodium falciparum, then you have to give the quinine. Remember, please remember, guys, please don't make any mistakes here. The patient diagnosed with the malaria in the second and third trimester, you have to give the ampicillin. Done, done, done. And also, guys, you have to remember the histopathological slides of the see here, guys. You have to see here. This is what this is look like the crescent or moon shape or banana shape here. It is the Plasmodium falciparum. Okay, na? What type of this is the we are having the we will see the Maurus dot. This is the Maurus dot. This is the Maurus dot. Okay, now just reverse the Plasmodium. This falciparum. MAMOUMURC. The Maurus dot. This is the thick rings. There is a scuffness dot. This is the scuffness dot. See, guys, Plasmodium vivax. This is the scuffness dot. How you are going to remember? See, Plasmodium vivax. In viva, they will shuffle the question. They will shuffle the questions. That's why the scuffness dot seen in the Plasmodium vivax. In Plasmodium malariae, it's like a band shape. It's a band shape. माला अंटार कदा माला बोलते हैं ना सी माला माला malaria band like सी माला माले malaria you will see the G means does you see the G means does see ma malaria means malaria okay mala G man what man G man malaria see the band shape okay na done so guys for the treatment please remember that in the northern east part of the India like Assam they will use the artemether and the lumefantrine. On the rest of the India, they will use the artesunate plus sulfadoxime pyrithamine. Okay, na? For the relapsing gas, for the killing the hypnozoids, we have to give the primacin. For the cerebral malaria, you have to give the artesunate IV. Okay, na? See, guys, for as you know, the primacin is highly contraindicated in pregnancy, also contraindicated in the G6PD deficiency. For the prophylaxis, guys, if a person traveling from the malaria endemic area to out, then that person have to receive drugs up to 28 days. Please remember what are the drugs? That is a moxifloxacin. That is, I think, just know the what are the drugs you are going to give in the prophylaxis, guys. Okay, na? See here, guys, we have in the total 2 tests, thick and a thin smear. For the thick smear, you have to do for the parasite identification. Okay, now for the thin smear, you have to do for the species identification. Okay, now malaria relapse we will see in the Plasmodium vivax, and the Plasmodium ovale. Okay, which are very important, guys. Please remember. Next one is, guys, ABG. From the ABG, we'll get the one question to do the interpretation, guys. Okay, now this is going to be very easy, guys. You just try to take a picture from the from the Google like ABG interpretation. There are many reports. Just try to interpret the ABG from the Google. Okay, na? Because they are just going to get from the Google only. Okay, na? Okay, so okay, na? See here, guys. I think everyone knows this is the ABG interpretation. Okay, na? See here, guys. See everything. I will just let me know this one. Okay. See. Wait. Okay. See, this is my handwriting. I used to teach the students, some like 10th class students, intermediate students. Okay. Now, see here, guys. pH. Wait. Okay. pH. You have to remember what is the normal value for the pH? It is the 7.35 to 7.4.5. 7.3.5. See, 35, 45, 35, 45, 35, 45. What 35? 735, 745, 737.35, 7.45 pH. Okay. Next, remember only this one. Remove 7. 35, 45, 35, 45, 35, 45, 35, 45, 35, 45. What? CO2. 7.3.5, 7.35, 7.35, 7.45 pH. Remove 7. 3545, 3545, 3545 what? CO2. Next, bicarbonates 2 to 26, 2 to 26, 22, 22, 22, 26, 22, 26, 22, 26. Next, O2, 8200. I think everyone knows. See, guys, if the pH is more, as you know that pH is more above 7, it is the alkalosis, is the alkaline. The pH is less than 7.35, it is the what? Acidic. Everyone knows. And also, guys, if there is a more CO2, obviously it is going to be it's going to be the acidosis. Less, if it is okay now. See here. So this will be like this one, okay now. This is less, okay now. Wait. See, if it is a if there is a less CO2, there is a less CO2, that is the alkalosis. Is the alkalosis. Okay now, alkalosis. Okay now. Oh my goodness, why I did like this one? Okay now. See here, guys. If there is a if there is a more HCO3, it is the alkalosis. If there is a less, okay na? Remember, if there is a less HCO3, it is the acidosis, okay na? Acidosis. Remember here, if there is a more CO2, it is the acidosis. If there is a more bicarbonate, it is alkalosis. If there is a less HCO3, it is the acidosis, okay na? Remember here, okay na? I think everyone knows this one. Okay na? See here, more CO2, acidosis, less CO2, this is the alkalosis. More HCO3, alkalosis, less HCO3, what? Acidosis. Okay now. Okay now. Then please try to interpret this one. What is this? ABG shows the pH is how much? 7.23. 7.23. How much is it? Less than 7, less than 3.5. It is what? It's the acidosis. It's the acidosis. HCO3 what? Is it normal? PCO2 is more. Means it is the respiratory. And POD is also normal. Is the respiratory acidosis. Okay. So guys, if you want to practice more, then please join my Telegram. Actually, I shared a lot of my real patient ABG interpretation. Then you can just practice there. Okay now, you can practice there. Okay now, you can practice there. See here, there is a one mnemonic. Yes, here if there is a CO2 and HCO3, if there is a oxygen, carbon dioxide, and the partial pressure of carbon dioxide and the bicarbonates are normal, and only pH is abnormal, then it is the case of the uncompensated. If nothing is normal, then it is the partially compensated. Okay, now it's the partially compensated. If there is only pH is normal, then it's going to be the fully compensated. Okay. Okay, I think no more confusion here. Okay, see here, guys. Here, guys, this is the Trendelenburg sign. This is the Trendelenburg sign. Okay, this is the Trendelenburg sign. Here you have to let's see with the cases. Okay, now a patient was lurching on one side while walking. Examination, it was found that when he keeps his right foot on the ground, then the pelvis drops to the left side. The sign shows in the image is positive, which is the locomotor diagnosis. See, guys, you have to remember one thing, guys. Here, you have to know this: gluteus medius and minimum. Gluteus medius and minimum is supplied by what nerve? Is supplied by superior gluteal nerve. Superior gluteal nerve. Superior gluteal nerve, which is the L4, L5, S1. What is the function of the superior gluteal nerve? Superior gluteal nerve is the it okay now. See, What is the function of the gluteal medius and minimus? It causes the abduction of the hip. Abduction of the hip. Okay, na? Abduction of the hip. It is caused by the gluteal medius and minimus. Okay, na? Okay, na? What if the superior gluteal nerve is going to injure? If the superior gluteal nerve is going to injure, guys, what happens is that abduction is possible? No. Is ablation is possible? No, no, nah. Then what happens? This one, suppose example, this one, guys, this one is damaged. Okay, this their muscle superior, gluteal medius and minimum muscle is minimum. It will be minimum. This is supplied by the superior gluteal nerve is going to die. Then will abduction possible? No. That's why, guys, abduction will not possible. That's why the patient will lurch. The patient will lurch on same side, lurch on like this one, and also, guys, if the patient is lurch on this side, okay, now he will take support of the opposite side. That's why the patient will lurch this side, like this one, like that. That's why it is called like the lurching. It is a lurching gait. Okay, now lurching gait. Okay, now remember, guys. Please remember. Superior. This is a on the same side only. Na lurching on the same side only. Okay. Also remember gluteal maximus, it is supplied by the inferior gluteal nerve. Okay, the inferior gluteal nerve. Done. And also, guys, last time there is one question that the physician is doing the something test, and there is a tender bulb positive. Then what does physician is observing? There is a one question. It is the abduction. Next one is the, guys. Next one is the. Next one is the. Next one is the. What is that? Next one is the. Next one is the vitamins, guys. Okay, na? Vitamin that helps in the collagen synthesis. It is the what is the vitamin C, guys. Okay, na? Please remember the all the vitamins. I think you are all very known to the. I think you all know about the vitamins. And also please remember the what is the first sign. The first sign for the first sign is the what is the conjunctival cirrhosis. The symptom is the night blindness for the vitamin A deficiency. Okay, no? Remember this one, the ophthalmias. Also, guys, there is a biochemical assay for the vitamins deficiency. Okay, now for the vitamin B1 we will do the RBC transcriptase test. For the vitamin B2 will the RBC glutathione test. B6 RBC transaminase, B9 Figlu test, Figlu excretion, histidine load test, B12 is serum methyl serum methyl malonate level. Okay, now please remember these guys. Okay, now they're the all important. Okay, all important vitamins. Okay, from the vitamins only, guys, you will get the up to 3 to 4 MCQs. So please master your notes, guys. Okay, master your notes. Okay. Next one is, guys, this is the vasculitis, types of vasculitis. Okay, now it will take, I think it will take 10 minutes to explain this one, but don't worry, I will just explain the important one. Okay, here, guys, this is the giant cell arteritis. Let's see, this is the giant cell arteritis, is also called as temporal arteritis. It's also called as temporal arteritis. See here, there is a 70-year-old woman complains of throbbing unilateral headache, and there is a vision problem. Throbbing unilateral headache, and there is a vision problem. She reports weight loss and the mandibular pain while eating. The patient also has a history of recurrent bouts of fever accompanied by malaise, muscle. Okay, now PE reveals nodal enlargement of the temporal artery with the pain or palpation. A biopsy obtained shows GN cells. What is the approximate diagnosis? It is going to the case of the temporal arteritis, also called as GN cell arteritis. Okay, now what is the most common is the headache. Specific is the Jaw claudication is the jaw claudication. I think she also having the pain while chewing the food. Mandibular pain. The most dangerous one is the loss of the vision. You know, is the temporal arteritis. Temporal arteritis. Yes. Remember, guys, we are having the C. It is a large cell vessel. Okay, this is a large cell vessel vasculitis. Just remember the guys from here. Remember the Kawasaki and Henash is important from here. Okay, na? Kawasaki and Henash purpura. Henash quadrant purpura is important. Okay, na? Please remember, guys, here. Just pause the video or just you can study in the PPT, guys. This one, guys, this is the Kawasaki. This is the most common in the less than 5 years old. And here you have the cream category. So cream means this is a C for conjunctivitis, non-executive bilateral, rashes as a polymorphous rash, edema, adenopathy, so that is cervical, and there is a mucosal involvement, that is a strawberry tongue, the fidget lips. Treatment you have to give the IVIG and also give the high dose aspirin, 80 to 80 to 90 mkd. So later you can decrease the 3 to 5 mkd after the ephedrine, after fever. Okay, they said. For the HSP, this is the small vessel vasculitis. Remember here, there is a, this is also called as IgA vasculitis. This is also called as IgA vasculitis. Also called as IgA vasculitis. Okay, now. Okay, now. See here. Okay, this is the most common children's. This is the, remember the PAR. Okay, na P, purpuric rash, mainly on the lower limb, buttocks region, abdominal pain, colchi pain, arthralgia, joint pain, renal environment, nephritis. Okay, now remember treatment with the self-limiting. But if it's severe, if severe, if it's severe and involves the GIT, it is the, then you have to give the oral prednisolone. Okay, now. The Wegener's granulomatous. Okay, if it involves the upper and the lower the lung and kidney, the strawberry gums, the antibody C and K. C. Wegener's. Remember Wegener's. Remember Wegener's means C and K. C and K only is in the Wegener's. Okay, na? Remember, please remember. Next one is, guys, this one is very important. This one, what is the most sensitive and least sensitive? See, always see here they ask, if we see here, guys, organs is the most sensitive is the gonads. Most sensitive is the gonads. Least is the vagina. Na? See here, blood cell, it is the lymphocytes. The most sensitive, the least sensitive is the what? Platelets. See here, cell cycle, it is the G2, see, G2M, see, G2M means more sensitive. See, more sensitive, G2M, more sensitive. Yes, least sensitive. See, G2M, M means more sensitive. Okay, na? Yes, sensitive, what? Least sensitive. See, very easy. See, tissue, it is hemopathetic, or bone marrow, it is least, more sensitive, and the least sensitive is CNS. Last time there is one question from this one. Structure of eye is the lens is the most sensitive, least sensitive is the sclera. Tumors, Evans sarcoma is the most sensitive, and the osteosarcoma is the least sensitive. See here, guys. See, always you have to follow this. Highly sensitive are Ewing's sarcoma, lymphoma, Wills tumor, multiple myeloma, seminoma. Okay, now these are the most highly sensitive. Okay, now you have to follow this one. If they will give any one of them. Okay, now. So one MCQ from here, guys. Okay, na? One MCQ from here, one MCQ from here. So we are covering very high yield topics for the FMG, guys. Okay, please remember. And also, guys, please remember that you are the types of lung carcinomas. Okay, like types of lung cancer. Okay, now please remember this is the most common lung cancer in India. It is the squamous cell cancer. Most common lung cancer in worldwide is the adenocarcinoma. So, guys, please remember it is adenocarcinoma. It is seen in the non-smoker. passive smoker. Non-smokers, you see the adenocarcinoma. Please, guys, they will give a big questions. Just you have to find the important points so that you can identify this is the type of the questions. This is the types of the cancers. Okay, now this is C. S for smoking. Okay, now S for smoking. These are associated with the smoking. Okay, now but adeno is non-smokers. C. S for center. Focus in the centrally. A for C. S for centrally located and S for C. S for smoking. S for smoking. Okay, na? And also S for central located and S for the central located. Central. Others two are periphery. For the SSC guys, for the squamous cell carcinoma, you have to remember there is a presence of the what? There is a presence of the keratin pulse. Keratin pulse is a P53 gene mutation. Just remember that in SSC you will see the keratin pulse. These are the one golden point. From the adenocarcinoma guys, there is a it is present in the non-smokers. Just find the non-smoker in the question guys. Okay, now it is the rash AGFR1 mutation. Okay, now rash A here and the one first only GFR one is A crash A. Okay, now see crash means we have an A here, GFR1 here. So okay, the crash is GFR1 mutation in the adenocarcinoma. In the small cell carcinoma, it is called as chota packet double dhamaka. It is the we will see the edgeoparity effect. Edgeoparity effect. It's also called as oat cell carcinoma. Okay, now we will see the to visualize this we have to stain the it is called as Fulgen stain. From the large cell carcinoma, guys, it is the periphery. The most common category is the gynecomastia. You'll see the gynecomastia in the large cell carcinoma. Just remember these golden points from the lung cancer. Okay, na? Remember this is and this one from the papillary. This is from the thyroid. Okay, from the thyroid, guys, you have to remember we are having the papillary, follicular, and the medullary. You have to remember this one. Okay, na? See, papillary thyroid carcinoma, you have to remember it is the papillary, it is due to BRAF mutation, BRAF B600E mutation. And the history of the radiation exposure, we will see the orphan Annie. We see the orphan Annie here. So you can see there is a cotton or orphan Annie type. This is the orphan Annie. There is a samoma bodies. I think everyone knows about the in what condition you will see the samoma bodies with the PCM square. Platinoma, papillary okay, na? Just remember the PCM score. There is a dystrophic calcification. Okay, samoma bodies means what is the dystrophic calcification. This is called as samoma bodies. Okay, na? See here the follicular carcinoma, guys, which is not diagnosed in the FNSA. It's not diagnosed in the FNSA. There is a RAS mutation. There is a capsular inversion. There is a C. All are C, guys. All are. See, guys. Here. See, guys. All are showing the lymphadogenous spread, but the follicle showing the hematogenous spread. See, guys, this muddy fellow, medullary carcinoma, these are originated from the follicular cells, but this guy is waste fellow, muddy fellow. He is suffering from he is taking the origin from the parafollicular cells. Parafollicular C cells. Okay, now C cells. Hence, there is a increase in the calcitonin. Increase in the calcitonin. Ret 10 men to A and to B, men to A to B association. Remember, which are the following thyroid carcinoma are associated with the men? It is the men to A, it is the medullary. Okay, now there is a whatever amylase, we see the acyl amylase. This is in the medullary, guys. I think everyone knows about surgery. What you have to do? You have to do the total thyroidectomy. Total thyroidectomy you have to do in the cancers, in the thyroid cancers. Okay, now, so guys, please remember here. Remember here, guys. This is the table very important. Last time also there is one question from the CDC and from the CG. That is the chronic granulomatous disease. Chronic granulomatous disease. There is always one question. What is the deficiency enzyme in the NADPH oxidase? For the screening test, you have to do the NBT, that is the nitro blue tetrazoline. You have to do the for the screening test. You have to do the for the NBT for the diagnostic test. You have to do the for the test. You have to do the DHR, that is the dihydro dihydro dihyd dihydrohodamine the dihydrohodamine. Okay, DHR test. Okay, dihydrorodamine. That's the test for this is the screen test. This is the confirmatory test. That is the dihydroamine. This is DHR test. Okay, now there is a respective burst cells. The respective burst cell the respective burst enzyme is the NADPH enzyme. Okay, now the NADPH oxidase. You have to remember this one, guys. Okay, now there always one question from this one, and also, guys, this is the one MCQ from this. It's going to come from this table. This is my guarantee. Okay, now you have to see this one. Celiac disease. This is the celiac disease syndrome, guys. This is the due to what gene? This is the list gene. The list, there is just CNS abnormality. There is just silvery hair. You can see here hemorrhage. There is a decreased immunity. She will see the albinism in the celiac disease syndrome. There is a Bruton's hypogamma globinomia. Bruton's is this one. All are seen in the boys only. Okay, now see the BBB. Boys, in the boys, it is the B cell defect. It is what gene? BTK gene difficulty. Okay, now remember. Please remember, guys. This one, Bombay also. This one, Bombay BG blood group. Can I please remember this? Study this table. One MCQ Pakka sure. And also, guys, from the hematology also there is a one question. I think you already know, guys. If the MCV, what does MCV mean? Mean corpuscular volume. Okay, it is shows it will explain either the blood levels, blood cells with the microstatic or microstatic size. Okay, na? If the MCV is less than 8, it is called a microstatic anemia. MC more than 100, it is called it is a megaloblastic anemia. Microstatic anemia, example, Sheetal, you'll see the sideroblastic anemia, and anemia of chronic diseases, T, thalassemia, A. Okay, now here, and see A, anemia of chronic disease, and T, it is the what is this raw? Lead. Okay, that's a lead poisoning. Okay, now see here, guys, you have to remember, guys, one thing here, the serum ferritin is the earliest to decrease and is the most sensitive test for the confirmatory test for the iron deficiency to the serum ferritin levels. Okay, now serum ferritin level. Also, guys, please remember here, guys, there is a one have to remember the serum iron. Serum iron is see, guys, here. See here, guys. Serum ferritin levels is always serum ferritin level is always inversely proportional to the TIBC. Serum ferritin is more, then obviously serum TIBC is serum ferritin is more, then TIBC is less only. Okay, see here, guys, for the iron deficiency anemia, serum iron will be low, serum ferritin is low, and the TIBC is more. Remember in iron deficiency, we'll see the serum iron is low, serum ferritin low, TIBC is high. Thalassemia, serum iron is high. Okay, na? Serum high, and the serum ferritin is normal. Okay, in thalassemia. In the anemia of chronic disease, guys, there is just serum iron is less, serum ferritin is more. If the serum ferritin is more, obviously TIBC is also less. Sideroblastic anemia, what happens here, guys? What happens here in sideroblastic anemia? There is a iron toxicity. It means more iron. That's why there is serum iron is more. obviously serum ferritin is more. If serum ferritin is more, obviously TIBC will be less. The sideroblastic anemia. Remember this one. So it's the Mendel index to see the what is Mendel index. It is the mean corpuscle volume and the mean for mean corpuscle volume MCV by RBC. You have to do the to calculate the Mendel index. If it is less than 13, it is the thalassemia. If it is more than 13, it is the iron deficiency anemia. Okay, now see here for megaloblastic anemia, we will be having the B12 deficiency and the folate deficiency. B12 deficiency, guys, we will see the symptoms of CNS symptoms, but in folate deficiency, you will see the there is no CNS symptoms. You will see only the risk. There is a risk of neurative defect. Okay, now you will see the there is a methyl melanine CoA increase in the urine. Here it is normal. This is how you have to differentiate between the B12 deficiency and the folate deficiency. Okay. Remember here, guys, for the iron absorption, for the iron absorption, what are the conditions which increase the iron absorption? It is the acidic pH and the vitamin C. With decrease tannins, phytates, alkaline pH will decrease the iron absorption. Site is the duodenum. See, ID card, ID duodenum. Okay, now I means iron, D means duodenum. Storage form is the ferritin. Transfer form is the transferrin. Okay, now transporter declared the D divalent mono. Transfer is the DMT1 and the hepcidin inhibit the ferroprotein, guys. Okay, just remember these golden points. Yeah, next one is, guys, I think everyone knows this, the biomedical waste. You have to see here the in yellow you have to use the anatomical waste, here solid waste, expired medicines, chemical waste, body fluids, and clinical waste. You have to put in the yellow boxes here. For the red one, contaminated waste, recyclable plastic bags, bottle, pipes, contaminated containers, catheters. You have to put in the red box. See, white fish with a scalpel, sharp one. Scalpel, blades, needles, syringes with fixed needle, sharp metals, needle tip cutters is in the, we'll put in the white one. B for broken. B for blue, B for broken. B for blue, B for broken. Broken glass waste, cytotoxic waste, metallic body implant. You have to see you have to put in the blue color boxes. You have to, okay, na? Next one is, guys, this is the trash system. Trash system are used in the emergency department in order to segregate the patient, like according to their severity. So, guys, there are four trashes. It is the red, yellow, green, black. Highest priority is the red. It means immediate resuscitation or life-saving surgery in the next 6 hours. Next 6 hours, it is the red one. You have to put the patient in the red trash, red zone. Yellow means possible resuscitation or life-saving surgery in the next 24 hours. Green means minor illness or ambulatory patient. Black means what? Dead and morbid patient. It means the patient who are about to dead. They have to put in the morbid. Okay. Guys, I think everyone knows this one. Alkaptonuria, black urine. It's euchronosis, homogenticide, oxidation, enzyme deficiency, albinism, tyrosinase, PKU, phenylketonuria. We'll see the psychiatric disorder, seizure, disability. There's a phenylalanine dehydroxylase, maple syrup disease, burnt sugar urine in urine. This is branch keto acid dehydrogenase enzyme deficiency. Example like ILV, isolation leucine valine. Lish-Nyhan syndrome. There is a self mutilation and increase uric acid. Always the picking the teeth. Always the child will pick the nails. Because here I will bite the lips also. Here the self mutilation is a HPRT deficiency. Hypoxanthine guanine phosphoryl transferase deficiency. You know? The next one is, guys, see here. This is from the anatomy, guys. You have to remember the arches. From embryology, this is the first arch. It is the malleus, incus, mandible. Second S steps. Fourth arch, you will get the left arch of the aorta. For the fifth one, you will get the left ductus arteriosus. Left ductus arteriosus. Okay, now see here, guys, from the pouches. Just remember the from pouches, guys. From the first pouch, you will get the middle ear cavity, artery tube, inner layer of the tympanic membrane. Second pouch, you will get the palatine tonsil, palatine and the tonsils. From third pouch, you have to get the thymus. Remember, it is the inferior parathyroid gland. Fourth pouch will get the superior thymus. Inferior three, inferior three, and the superior it is fourth one. The parafollicular cells are from the fourth one. Please also guys remember the they may give this image, and also they will just mark you guys what are the organs and what are the steps will arise from this way, from this layer. Okay, na? Just remember that. Also guys, I think everyone knows this one. This is the transpyloric plane. This is the lower border of L1 L1, lower border of vertebra L1. This is the subcostal plane. This is the L3 transtubercular plane. It's the upper border of the L5. I think everyone knows about this one. Okay, now please don't make any mistakes in the exam. I think I know about this one. The disaster management. This one disaster management, guys. So guys, the most commonly reported disease in the post discharge is the gastroenteritis. The gastroenteritis. Micronutrient deficiency is the vitamin A. Micronutrient deficiency is the vitamin A. Okay, now the only vaccine given is the tetanus. Please remember here, guys, the disaster management cycle. It okay cycle for the disaster management. See here, disaster. See here, first one disaster impact. There is RRR, response, rehabilitation, and reconstruction. A response, rehabilitation, reconstruction. This is the mitigation and the preparedness. Next one is it. Okay. Remember this cycle. Remember this one all. Okay. Next one, guys. Side effects of lithium. Lithium. So let's just remember the side effects of the lithium and the amiodarone. See, lithium, let's remember the side effects by the name itself. Mnemonic is lithium. L for leukocytosis, I for insipid diabetes insipidus, T for tremors, H for only hypothyroidism. Okay, only hypothyroidism. Okay, na? I for increased weight, obesity, U for upset, stomach upset, L for malformation, called as abstinent malformation. Remember the amiodarone. It is the symbol PCB, Pakistan Cricket Board, MLA nothing. Pakistan Cricket Board, MLA nothing, NT. So you have to remember the P for pulmonary fibrosis, corneal verticillata, blue man syndrome, myocarditis, liver toxicity, neurotoxicity, and also guys, T for this is thyroid. It is both thyroid, hypothyroid and the hyperthyroid, but the most common is the hypothyroidism. Remember guys here. The next one is guys, I think I already discussed about the TB drugs here. Okay, now TB drugs here, guys. TB drugs and the diabetic drugs. Okay, now TB drugs and the diabetic drugs. I already I discussed this one multiple times, guys. Multiple times. This one. Okay, now just please read this one. Okay, now please read this one. From this wall, we will part one is bedaquiline, ethambutol, and rifampicin. All are important. Just remember the side effects. Okay, now from the diabetic drugs, guys, are important. Mainly the SGL2, SGLT important, DPP4 inhibitor important, sulfonylureas and the biguanides are important. Okay, just read this one. Next one is the guys. This is the prevention types. Okay, now see here, guys. Just remember this one. Level of prevention. Okay, now we are in the primordial, primary, secondary, tertiary. See here, guys. There is no risk. There is no risk. Okay, now it is the primordial. Primary, there is a risk. So, for example, health promotion, there is a specific protection. That is the primary, guys. Secondary, guys, like example, secondary example, like any treatment or diagnosis. If you are doing the treatment and diagnosis, you have to it is the remember in the question there is a treatment or diagnosis, that is the secondary. Tertiary means it is the disability, limitation, or the rehabilitation. It is the tertiary, guys. Remember the normal life. Normal life, there is a risk factor. So the normal life, there is a risk factor because, like, suppose, okay, now you have to tell to your children that okay, don't watch too much TV because okay, na this is the normal is the because there is a risk now. That's why this is the if you are telling to your children, okay, because they don't have even though they don't have anything, but for the sake of their health, you are telling before only that, right, please do not watch the TV at more than like that too much. It's primary prevention. If there is a risk factor present, that's why you have to is a primary health. This is the primary prevention. Okay, na? Remember, guys, this is the logic to remember here. Minimum of how many antenatal care as per government of India? It is the government of India is 4, ideally 14. WHO it is the 8. Remember the calorie requirement. Okay, na? In pregnant women, it is the they must add plus 350 kilocalories extra. In pregnancy a lactation, guys, 0 to 6 months, you have to plus 600 calories. More than 6 months, it is a 520. Remember how they will get these plus 350 calories by eating what? By eating uh, by eating extra meal. Okay, extra, just double the meal. Okay, get us. Thank you very much, guys. See you in the next video, in the next session. Thank you so much, guys. Take care.